pretty good. Let's see if they can give me the pros and cons of each plan. Alright, that's true. Part C plans have a maximum out of pocket. And coordination of care. I guess coordination of care can be a pro. Potential cost savings. Cons for Part C, definitely limited network. Regional availability. Oh, PA is a huge one. Travel limitations, definitely. Medicare supplement plans, pro, yep. Can go anywhere that original Medicare is accepted. Out-of-pocket cost reduction, that's true. You do have expenses not covered by original Medicare. That, yep. So co-insurance, co-payments, suitable for people who travel often. Standardized, easier to compare plans, true. Cons, definitely if you have a Medicare supplement or Medigap, you need a Part D plan. No additional benefits, that is true. You need dental, vision, hearing. Medigap does have higher premiums. Pre-existing conditions restrictions. So if you don't enroll, and it says that, if you don't enroll during your initial open enrollment period or you don't have guaranteed issue rights, you may have higher premiums or denial of coverage or exclusion of pre-existing conditions. Oh, this thing is really good. So it looks like it's doing a pretty good job. Let's see if it can handle more intricate inputs, like if I have some issues of, let's say, individual circumstances. Oh, that's pretty good. Now, of course, Medicare open enrollment period is actually between January 1st to March 31st. Medicare.gov gets that wrong, so whatever. AEP, the annual election period, is October 15th through December 7th. It's only to confuse agents because that's what they test us on our annual recertification test. All right, yep. So very true. All of these things are very true. Now again, I'm using ChatGPT 4, so it is going to generate these answers slower, but there is more reasoning and more conciseness in the output, so it's pretty good. This is really good. There you go. You notice how on every single one of these it tells you to consult with a licensed insurance agent, financial planner, or state health insurance program, the SHIP program. Even ChatGPT 4, it's trained to do this. It's trained to always say, if you're giving any kind of advice, to always tell it to talk to somebody who is trained. That's pretty important. I agree with it, but also know that when you add in the human component, there is an aspect of bias. So let's see. Now that is good, but we can get a little bit better. Now let's see if there's any way we can figure out how ChatGPT can give us better personalized information based on, let's see, a set of scenarios that I give it. Can't spell. Let's make sure we let ChatGPT know that I've already qualified and received an offer letter so that it knows that there's no underwriting that it has to consider or tell me that I should consider. So what I did here was, I'm trying to figure out if ChatGPT can give me some good things to consider about switching versus not switching, and also what are some other things to consider. And I'm gonna prime it here because sometimes you have to give it like where your thought process is going, because a lot of times ChatGPT will give you like really general things. When we look at ChatGPT, and hopefully it can capture this, ChatGPT runs off data, right? So data and information is trained here. AI is trained on data and information. What our job is as prompt engineers, when we're trying to talk to it, is we're trying to focus on up here, these two, knowledge and wisdom. It doesn't have knowledge and wisdom. ChatGPT just has these things. ChatGPT is trying to, based on what we tell it, generate output based on information that it has, but it has so much information. So the way I like to think about it is, imagine ChatGPT is a intermediary between, let's call it, a panel of doctors and you. And you ask ChatGPT, what is the best diet for me? And ChatGPT turns around and says to this panel of doctors, what is the best diet for somebody? And these panel of doctors spit out all this information, and ChatGPT just, it's a computer, right? And takes all that information, summarizes it, turns around to you and tells you what the doctors say, without any context of who you are, really what your concerns are, and what your dietary needs are, and what you're trying to accomplish, right? So there's no idea. On the flip side, neither do any of these doctors. So our job as prompt engineers is to try and tackle both the you end, right? Who are you and what are you trying to get? And then the back end, what data and information specifically are we trying to get, right? Because there's a very big difference between seeing like a cardiovascular doctor versus seeing a pulmonary doctor, right? They both can treat the body, but they treat different aspects of the body in very different ways and different organs, and they might have a different aspect on how they want to treat you, and you might have a very different perspective on how much different medications you want to take, right? So that's how we need to generate this prompt to figure out if we should do this, right? And see what we should do as far as the kinds of things that come on. And I also want to know what it's going to tell me. Okay, that's true. MACRA came out, MACRA, which made it so that you could no longer enroll in Plan F if you weren't already enrolled, and if your Medicare Part A started in 2020, January 1st, you can still get a Plan F. All right, so now with the pros and cons of, let's go back up here. So let's see how it did. So it tells us, well, it's an AI language model. It can't really give specific advice, but it gave us an overview of both Plan G, Plan N, and of course Plan F. And yes, this is all true. Now again, the Medicare Part B deductible changed in 2023, but that's okay. At least it had 2022 information, which is interesting. I guess it would, because it knew what the Part B annual deductible would be in 2023 or in 2021. This is all true. Plan N is typically less than Plan G, yes. The pros of switching from Plan F to Plan G: lower premiums, that's true. Comprehensive coverage, it's true. Cons: additional out-of-pocket. So yep, Plan G and Plan N, they do require you to pay for the Part B annual deductible. Plan N has higher and doesn't cover excess charge. I was wondering if it would catch that. That's very good. Risk of higher future premiums, that's the same for all the plans though. In your specific case, considering good health visit, you may find switching to Plan G or Plan N could result in cost savings, so it's crucial to weigh the potential saving premiums against the additional out-of-pocket cost. Consult a license. Okay, so I thought it might catch this, but I guess it didn't. I specifically asked it, or I specifically made the $200 per month Plan F and the $160 per month Plan G a $40 per month difference, so it's a large gap, $480 per year. And the Part B annual deductible is only $233 as of the memory that this thing pulls up. Therefore, the cost savings of switching to a Plan G, regardless of any out-of-pocket expenses, would make sense to switch. So let's see if somehow I can tell it that. Let's see what it says. Because this would be direct question. Because up until now we've been asking it general questions, pros and cons. Now I'm asking it a question that is direct. Oh, it's thinking. Maybe it'll crash. Ooh. This is interesting. It's taking the longest. Wow. Did my internet crash? No, it didn't. Okay. It's much better than the network error one, right? Yeah, it's much better than that. So it is better. Better. Alright, so I guess it gave me a better one. Granted, standardized benefits plus the ability to have the only difference between Plan F and Plan G is the Part B annual deductible being paid for under the Plan F and Plan G not. I would think that this AI model would be able to detect that, but I guess the language from Medicare.gov makes it not so plain. But well, I guess they really want you to talk to somebody. It's interesting. It's interesting. Let's see if I can prompt it a little further and see what else I can get out of it. Let's see now if it can tell me between N and G. Okay, excess charges. Plan N has co-payments for the doctor visits. All right, so that's great. It remembered the Plan N costing 130 and the Plan G costing 160. Sometimes when I run these prompts for so long, they tend to blur the lines, and it could just be, or blur the amount that it costs. So it could just be that it's hard, or that it does not, that it forgets. It's just that there's so much in new data that comes in that it mixes it up. But it does remember. See, it looks like the annual difference is $360 per month. You can take that into consideration. If you're going to the doctor 2 times a month, that's $480 a year. So think about that. But then you still have to pay the annual deductible. So take that into consideration, because you have to pay that on both Plan G and Plan N. See, because you only go to the doctor, like I said, twice per year, right? My current doctor doesn't charge excess charges, period. And as I mentioned before, I only go to the doctor 2 times a year. Do you think objectively, based on the facts discussed with me up till this point, Plan N makes the most logical sense? Let's see what it says. Look at that, it gives me a summary of the factors discussed. Right, and given these factors, it appears that Plan N could be the best cost-effective choice for you, considering your low healthcare utilization and the absence of extra charge from your doctor. However, it is essential to review the plan details and consult with a licensed insurance agent or financial advisor for personalized advice based on your specific situation before making any decisions. They can help you assess the potential savings and risk associated with each plan and choose the best option for you. And this would be primarily because this is the world of insurance, and there's other things to consider, like dental, vision, hearing, long-term care insurance, because Medicare supplements don't cover everything. There's Part D plans, and we can even ask it, like, what are other plan details that I should be consulting with a licensed insurance agent or financial advisor? Hang on. About, based on my specific situation, can you help me make a list? All right, let's see. So now you can figure out how to come to some kind of a decision-making factor when you're talking to a financial advisor or an insurance agent. All right, premium calculation method. So Medicare insurance companies have a way of calculating how they raise the premium every year. Premium history and stability. Each plan has a history of how much and how often they raise the rates, usually every year, 2 times a year sometimes, policy provisions, limitations. So this person was underwritten. Were they underwritten with no pre-existing conditions? Did they have a lot? Network restriction. There's some Medigap plans that actually are like Medigap Plus plans where they actually have preferred pricing if you go in the network, which is really odd. Most Medigap plans don't create that, but some of them do. Customer service and claims processing. So this is where Medigap plans don't have this problem. So customer service really only has to do with billing. So as long as the Medicare supplement plan bills you correctly, there is no issue, because Medicare supplement plans work directly with Medicare A and B. So when you buy a Medicare supplement plan, your Medicare A and B will bill the Medicare supplement plan directly. So all you need to do, go to the doctor office, show your A and B card, that red, white, and blue one, and tell your doctor you have a supplement plan. They will bill Medicare. Medicare will send you and the doctor a summary of charges, and if you have to pay your Part B deductible, they will let the doctor know how much you have to pay. You will get a summary, say this is how much you have to pay the doctor. It's called the MSN, it's your Medicare Summary Notice, and then you will pay the doctor the amount owed. Up until that point, once you pay your deductible, from that point on, the Medicare supplement plan will pay your physicians directly. Now, for prescription drug coverage, look, it remembers, since you're satisfied with your current Part D plan, ensure that switching Medigap plans won't impact your prescription drug coverage. And it won't, because they no longer have the old plans, forget what they were called, J or something, where they actually had prescription drug coverage on. Those were phased out a long time ago. Future health needs. Discuss your current health and potential changes in healthcare needs in the future. Help to determine whether or not a more comprehensive plan, like a Plan G, might be more suitable for you. So Plan G, which covers excess charges and covers doctor office visits as ER and ER. So if that is something of concern, maybe paying the extra $30 a month, $360 a year for this particular person might set them at ease. So maybe that's a better option. Guaranteed renewability. So confirm that the plan you're considering is guaranteed renewable, meaning that the insurance company cannot cancel as long as you pay the premium. So all Medicare supplement plan companies, unless they've invented some in the past year, are like this. So they have to be guaranteed renewable. Unless the company fails, in that point, typically you have a guarantee issue. So let's say you accidentally signed up with your friend who decided to sell you a XYZ Medicare insurance supplement plan, and that company folded after 6 months. Then you will have a guarantee issue right into some other company. Unfortunately, the guarantee issue only allows you to buy either a Plan F or a Plan G, depending on your age, but you at least get guarantee issue into another company. Waiting period and pre-existing. Now for this particular person, most likely because they're super healthy and have no chronic conditions, they wouldn't have a pre-existing exclusion on their application. But typically if they did, pre-existing exclusions last 6 months, and pre-existing is only pre-existing exclusion for the Medicare supplement plan. So what that means is they still have A and B coverage. So if they went to the doctor office for let's call it that specific thing that the Medicare supplement plan is not covering, then A and B coverage would still work, but the supplement plan coverage would not. So you're not paying 100% of the coverage or the bill, you are paying for just whatever A and B are not. All right, so having this list in handy. So just, this is a very good little back and forth we had with ChatGPT, and took about half an hour, but it's a good way to just talk to it and see. I like this. I think it knows enough information to get you started if you want to use ChatGPT as a Medicare informant for your Medicare journey. So I think it's a pretty good thing. Definitely, I have a lot of information in here that helps, but if you do have any questions, wanted me to ask ChatGPT something, and if I thought it gave a relatively good response, let me know. There were some things in there that were a little bit shaky, but we worked through them. But before you go on ChatGPT and make some informed decisions based on ill information, be sure to ask me in the comments below. I'll ask it, tell you what I think, and then you can make informed and educated decisions on your Medicare, and we'll see you in the next video.